Hello everyone, welcome back to my channel Medical Research with Mohan. I am Dr. Mohan Raj Sharma and today's topic for discussion is concept of research design in clinical studies. In this video, I will first define and describe common research designs. Next, I will help you navigate research design choices based on research question along with real-world examples. Let me start this presentation with this quote from Dr. Moody. The best way to show that a stick is crooked is not to argue about it or to spend time denouncing it, but to lay a straight stick alongside it. The beautiful example of comparing with something else before you come to a conclusion. You must have remembered this research cycle I presented in a couple of videos ago. Any research starts with identifying the problem, then reviewing of the literature, then you set research questions, objective and hypothesis, and then comes the choosing appropriate research design. At this stage, after you choose the research design, you write the research proposal either to submit to the institutional review committee or funding agencies for fund. Let's first describe what a research design is. It is the blueprint of your project, and it is an approach we should take to collect and analyze the information related to research based on your research question. And these are the importance of having a good research design. Sample size, choice of statistical test, and conclusion drawn depend on the design. And proper design is critical. Analysis cannot rescue an improper design. These are the typical questions you encounter in the proposal. Is it a qualitative, quantitative, or a combined study? Is it descriptive or analytical in nature? Is it an observational or an interventional study? We'll answer these questions in the subsequent slides. So this slide describes the difference between descriptive and analytical study. In descriptive research design, a picture of what is happening in a population without quantifying the relationship is obtained. For example, prevalence of a disease. Whereas in analytical study, the investigator tries to establish the association between exposure and outcome, or in another word, independent and dependent variables. In descriptive study, no hypothesis is stated, whereas in analytical study, hypothesis is a must. Descriptive study uses descriptive statistics to summarize the data, whereas in analytical study, you use inferential statistics, such as statistical tests to come to the conclusion. The examples of descriptive studies are case reports, case series, and survey studies, whereas in analytical studies involve analytical cross-sectional case control, cohort studies, and randomized control trial. This slide describes the difference between observational and interventional studies. In observational study, the investigator is a passive observer. Observational study can be descriptive or analytical, but because of their observational nature, they are less powerful to generate evidence. Whereas interventional studies, the researcher modifies and controls variable to test a research hypothesis. By default, they are analytical in nature, and because there is there is manipulation of the exposure, they are more powerful than observational studies. Not necessary all the time. A poorly performed interventional study may be inferior to a well conducted observational study. If the study involves human, it is known as clinical trial. So let's briefly go to the design type. First, research design. If you have intervention, it automatically becomes interventional, whereas if you just passively observe, it becomes observational. And interventional can also be of two types. If you do randomization, then it becomes a randomized control trial. But if no randomization is done because of the ethical or other reason, it becomes a non-randomized trial. Non-randomized trial is equivalent to a cohort study. Observational study also can be of two types. In one group, you put comparison, and in another group, you do not put comparison. The study which doesn't have a comparison group are by default descriptive in nature. The examples are case report, case series, or descriptive cross-sectional study. In analytical study, examples are cohort, case control, or analytical cross-sectional study. So when you have a control group or comparison group, automatically the study becomes more powerful. Cross-sectional study, this is an example of a rose, a picture taken of a rose. This is a snapshot of time. It doesn't say anything about this rose a week ago or what will happen to this rose after 1 week. So this is the limitation. The advantage is you can get a quite large sample size in a short period of time, and they are less costly in nature. This is one example of the cross-sectional study performed and published in Nepalese Journal of Ophthalmology. In case control study, the research starts at this point and it goes back in time, though you recruit the patient prospectively. So this is the study population. You get the disease present, disease absent, and you take the history. How many of them were exposed uh, of the risk in the past, and you draw the conclusion. Case control studies like this is a rule. So you go back in time and you now know 1 week prior to taking of this picture, the status of the rose was like this. Let's talk about the cohort study. Cohort study doesn't generally go on, they are prospective in nature. So you start your research here and you go direction of the research is towards the future, and this is how you carry out the disease. So the population should be at risk but disease free when you recruit the patient. For example, if you are doing a study regarding the uterine disease, then automatically males should not be recruited as study population because they are not at risk of developing any uterine disease. So cohort study, this is the example, same rose. Now I know we follow this rose for a week and the condition of the rose is like this. It has withered a lot. So cohort study rarely gives you what will happen to a event or disease in future. The disadvantage of cohort study is if the lag time of the event of interest happening is very long, then the risk of for loss to follow up will be very high. To summarize, this is the example of cross-sectional study. This is an example of risk control study, and this is an example of prospective cohort study. Briefly, let's discuss about the interventional studies. As I said earlier, in interventional study, the exposure is manipulated and they can be randomized or non-randomized. So randomized control trial are called the Supreme Court of evidence because they generate the highest grade of evidence. The three terms randomized, control, and trial merit explanation here. So randomized means that every participant in the sample has equal chance of being selected to either groups, so that you ensure equal distribution to the study arm or experimental arm. Control has two meanings. The first meaning is two or more groups are followed and treated in exactly the same way except the exposure. That is to say, they are in a controlled environment. But the more accepted explanation of the control is there is one group of patient who receive usual treatment and another group gets the novel or experimental treatment. So the group of patients who receive the usual treatment serve as a control. That's why the word control. And trial means that you are doing some kind of experiment to understand which treatment is better in a disease. But however, this could be a very ethical issue, and the principle is called principle of equipoise, means that there should be uncertainty as regard to which treatment is better. If already the previous studies have shown that one treatment is superior to another treatment, then no trial is allowed for ethical reason. So this slide shows the type of clinical question and the best research design you should select. This I took from the book I wrote. It's a principle of health science research. So for all clinical questions, systematic review and meta-analysis is done. In subsequent videos, I will talk about what a systematic review is, what a meta-analysis is. For this video, systematic and meta-analysis are done when the previous studies are underpowered because of the rarity of the disease and the small sample size. So if you get a good systematic review and meta-analysis of a topic, then you get all clinical question answered. If you are looking for a answer regarding a clinical question on therapy, then cohort study, case control study, case series are the one you should do in decreasing order of priority. Same thing happens with etiology also. But for diagnosis, randomized control trial and cohort studies are recommended. For prevention, you can do RCT, cohort study, case control study, or case series, again in decreasing order of priority. And for prognosis also, these are the type of study you should be conducting to get the answer. To summarize today's short video, choosing appropriate research design is extremely important to get the desired answer to your research question. The research designs are broadly divided into observational or interventional. Observational studies are emerging as important sources of evidence in healthcare research because randomized control trials are very expensive and difficult to carry out for many reasons. Case reports and case series, cross-sectional studies, case control studies, and cohort studies are common observational studies in clinical research, and randomized control trials are the supreme court of evidence, producing the scientific evidence of highest grade, but they are very expensive in nature and require a lot of resources. I hope the information presented in this video helpful in your research work. I hope to see you next time. Bye.